Hello, everyone. Hello, hello. It's Alicia Hurt here, your servant leader. And we are here to talk about infertility. Let's talk about it. Let me change my privacy settings so that way you can share it with a friend. Let's do it. Let's do it. How's everyone doing today? How are you? I am definitely relaxed. I will share with you why a little later on, but let's talk about infertility. I want to make sure that both of our pages have the live so that we can get started. I don't want anyone to miss out on this live today. All right, here we go. We are talking about infertility. So again, my name is Alicia Hurt. I am the executive director and founder of I See My Baby. We are located here in Bainbridge, Georgia at 310 South Scott Street in Bainbridge. And we are here to support you overcoming infertility, a lack of faith, and battling depression. So this series on infertility, I want to keep it light. We're going to do this in the weeks to come. So we'll build the momentum every time we talk. So thank you so much for joining us today to talk about infertility. We want to normalize this discussion. In my book, I See My Baby, which is the reason for this nonprofit. On my journey overcoming infertility, I definitely felt by myself. I felt like no one truly understood what I was going through and how I felt inside. I was able to put my mask on and go to work, and I was working for the Department of Transportation at the time when I was like really full-fledged into trying to be a mother, right? And then going through my in vitro and things of that sort. So I want to normalize the discussion and help that woman out there understand and know that you are not by yourself, that we understand you, that we're here to support you, and we're here to help you through your journey of healing and overcoming. And just letting you know that, hey, no matter what it is, there's no judgment. There's no judgment. Only the results, the desired results, is to overcome infertility. And we're going to talk today a little bit about causes and statistics, the natural versus the medical approaches of healing, and also how you can take that next step in reaching out to us here at I See My Baby and helping you personalize your program and getting you to where your heart's desire. I want to make sure also that you guys understand that I am not a licensed medical professional. I am not a doctor, OBGYN. My name is Alicia Hurt. I'm a doula, a life coach. I also support with herbal remedies and things of that sort, but I am not a licensed medical professional. Okay, let's get to it. So what is infertility? What is it? Let's talk about what it is. Let's define it. It is the inability to conceive after 1 year, 12 months of regular unprotected intercourse, or 6 months if you are over the age of 35. So primary infertility is when a person has never conceived before, never had a baby, never been pregnant, never just, that is what primary infertility is. Secondary infertility is when a person has a difficulty conceiving after previous pregnancies, and both affects men and women. So the statistics in women is 1 in 6 couples worldwide, they encounter or experience infertility. And in the US specifically, 10% of women aged 15 to 44 have difficulties getting and or staying pregnant. And some of the common causes that you will hear is the PCOS, endometriosis, hormonal imbalances, which we touched on yesterday, fibroids, and age-related decline. In men, it contributes to 40 to 50% of cases. That's higher, 40 to 50% of cases. And the common causes are low sperm counts, poor sperm, your hormones again, your lifestyle factors. Maybe you smoke or you take excessive alcohol or you have a poor eating habits, poor diets. So let's go through these definitions, and I need to move this bar over some. Okay, so PCOS, it is a hormone disorder, and it causes enlarged ovaries with small cysts, and it leads to irregular periods and infertility. So that's one cause. And then endometriosis, it's a condition where tissue similar to the uterine lining grows outside the uterus, and it causes pain and infertility issues. And some women, they see it, yes, primary, but then it's common when women start to see it secondary. And they're like, well, I had a baby, what's the problem? And it develops over time. So it really just depends on your body. Fibroids. Now, these are non-cancerous growths in the uterus that can affect fertility and also pregnancy. And sometimes they get so large that women will say, you know, it looks like I'm bloated, but actually those are fibroids. They could be quite painful. So on the male factor, the sperm is the ability of sperm to move efficiently to help with fertilization. So that's one of the causes of infertility, the sperm motility. Also the hormonal imbalances, so those disruptions in your hormone levels, those can contribute to infertility as well. So when we talk about natural approaches, natural ways to combat infertility, natural healing approaches, we can talk through a scenario to kind of break that down. So here we go. Scenario one. A 32-year-old woman, she has PCOS, and she is struggling with irregular periods. Excuse me. So to take a natural approach, she can adjust her diet so she can include anti-inflammatory foods, right? To take herbal supplements like spearmint tea and practices to reduce her stress, because when you're high stress, things don't go like it's supposed to. Your system is all out of whack, and you're just not able to conceive and be pregnant. And do things like yoga, which we offer here every Monday at the center. So the outcome is ovulation becomes regular and increasing the chances of conception. So once you start to do these things, meaning eating those foods that are anti-inflammatory foods, doing the supplements, doing the herbs, the spearmint tea, the practices, I'll even throw in here the yoni steaming as well. That definitely supports and get the body moving. And it also will help to regulate your periods and decrease those symptoms of the PCOS. In this second scenario, there's a 35-year-old man and he has low sperm, and it's due to his lifestyle habits. So on the previous slide, we talked about those things. Maybe it's alcohol, maybe it's smoking, maybe it's just a poor diet. So a natural approach to combat that would be to improve your diet with antioxidants, reduce alcohol consumption, regular exercise, and taking supplements like zinc and vitamin C. And I don't know if older folks have wisdom. Like my mom used to tell us, take the zinc like when we're sick, and it'll really help to boost you, and the vitamin C, pump it in your system, and it really will help you. So it's similar to that, with to pump it up in your system so that it can help you with your mobility, with the low sperm count. It will help get it going, right? Reducing that alcohol consumption and things that aren't good for you can help with that as well. And getting that regular exercise in. And the outcome, again, is that your sperm motility will improve, and it enhances the couple's fertility. Now, these are just suggestions on some natural approaches. Again, as we go into our weeks and we have various topics that we kind of dive deep into, we'll have more for you. We'll have more suggestion, more options, more natural approaches for you. But today is just our opening up. This is our opening up the discussion and normalizing the infertility discussion. Okay, medical treatment options. So here are 2 scenarios on the medical side. Again, I am not a licensed medical professional. I am just sharing information with you, but you definitely want to talk to your doctor. So a 40-year-old woman diagnosed with endometriosis and facing painful periods and difficulty conceiving. So the medical approach, you can go through different surgeries and procedures to remove those tissues and to start some type of hormone therapy. And the outcome of that would be that you have that reduced pain and that you increase your fertility chances. With scenario 2, it's a 30-year-old man with very low sperm count due to hormonal imbalance. So the medical approach would be to go through in vitro or another injection, which the acronym for that is ICSI. And when you try that, you will be successful in fertilizing eggs, and it will lead to pregnancy. So you have your natural way, you have your medical way. And again, this list for medical is not exhaustive, but these are just 2 scenarios to kind of open up the discussion on both pathways. Of course, I love the natural way because you don't have to go through all of the injections and the procedures and things of that sort. It's not as stressful. For us personally, as the Hertz, we did go through the in vitro and having my husband inject me and the timing of everything. And then we're trying to dose and make sure we read the paper. It was very stressful for us, but the natural way, now there's going to be some stress, I mean, with anything, but it's not as excruciating as the medical, but some people have to go that route. So it really just depends on your particular situation, which route you take. And be okay with it, because there's no judgment. Because at the end of the day, everyone's journey is different. I started off with my journey being IVF, and it didn't work for us. And so we ended up having to go the natural route. So it just really, really, really depends. You may start natural and go medicine. You may start natural and just, it works. You may say, I'm just going to go the medical route. It really, really depends on you. Now here at the Women's Wellness Center, I see my baby. What we provide for as far as support is we have a 10-week course, and it provides you education on your health, on infertility, some of the things that I shared today, and it goes even deeper. We also provide the life coaching, which is one-on-one support. You'll get paired with either myself or our fellow life coaches that we have here at the center. And then we help you with your professional goal, your personal goal, your emotional goal. We just help you all around, 360 degrees all around. And then we have the mental health counseling. We have practitioners here that address your stress, your anxiety, and your emotional well-being, because going through infertility, you need your mind to be in the right place. And some days you feel like day one, just like grief. It's similar to grief. You feel some kind of way and you go through different emotions on your journey. So you need a mental health practitioner to support you. As I always talk about, the yoni steaming program, we have that here, depending on what your situation is, what your diagnosis is, what you desire. Because if you're aggressive and you're like, no, my goal is to be pregnant in 6 months, 3 months, then your yoni steaming program will look a little different than someone that's saying, you know, we can do about 12 months. You know, it just really depends. We customize the program for you, and it supports your reproductive health through herbal steaming therapy. We also have ongoing classes and a safe haven here for you through our retreats, our support groups that we have. We are gearing up, and we just had a meeting with our partner to have a local day retreat here in Bainbridge. So that's something else that we're adding to be your safe haven, to give you a place of serenity here, to nurture you and to just wrap our arms around you, to let you know that you are not alone. So in conclusion, as I run to my next meeting, y'all, infertility is a common but treatable condition. It is treatable. And both natural and medical approaches can help individuals and couples achieve their fertility goals. The Women's Wellness Center, we offer a holistic, personalized support system to guide you on your journey. So please contact us to start your healing journey. Our phone number is 2299. At info@icmybaby.org. Visit us on the web at icmybaby.org. We are on all social media platforms. You can come and walk in Monday through Friday, 9 a.m. to 4 p.m. or on Saturday, 9 a.m. to 1 p.m. Or you can just slide in our DM and we will respond within 24 hours. You guys, I love you. I hope that this discussion opens up the dialogue to normalize, hey, my name is Alicia and I do suffer with infertility. But I know that infertility is common, but a treatable condition. Okay, have a good day, you guys. Bye for now.